Hello, welcome to our broadcast today. My name is Victor. Today we have a very good one for us. We're going to be talking about childhood experiences and how they affect our mental wellness. Childhood experiences, the things that kids go through or that we went through that affects us mentally, that affects our mental balance and mental wellness. There are extensive research that has shown that the things that happen to kids also happen to them when they are adults. It affects them mentally. These things are divided into three classes, if you will. One of them is abuse, the other one is neglect, and then the third one is household dysfunction. And I'm going to give you an example. But before I go on, please subscribe to this channel, like what we're doing, share the channel. That is what we get from you. What you get from us is free broadcast on how you can care for your family, how you can be more effective as a practitioner, whether you are a coach, a counselor, a mentor, a caregiver, a school proprietor, a nurse, a pharmacist. If you have anything to do with people and healthcare, these broadcasts are geared and designed to help you to be more effective, even as a parent. So subscribe to our channel, share the channel. It will help you and help others. So as I was saying, there are three groups: abuse, neglect, and household dysfunction. Under abuse, we have obviously physical abuse. Children that go through physical abuse, whether they observe it or it happened to mom or it happened to them, it affects them. The second one is emotional abuse. And the third one is sexual abuse. All those are categorized into abuse. And then we have neglect, physical neglect, emotional neglect. What are those? Perhaps I may add a little bit of it. Physical neglect will be mom or dad is not there, not physically present. Caregiver is not physically present. The child cannot get what they want. When they are hungry, they're crying for hunger, I need food, nobody's there to provide it. That's neglect. When they are antsy, irritable, they need a shower, nobody's there to provide it. Those are physical neglect. And then we talk about the emotional one. Mom or dad or an adult or caregiver is not emotionally available. They may be physically there. They are not connecting with the child. They are not providing that nurture that the child needs. The child has nobody to run to when they are emotionally disturbed. These are emotional neglect. And then we have the third group, the household dysfunction. These are the ones that are a little bit abstract, but you'll connect with it as we begin to talk about it. Number one is when a child has a parent or a member of the family that has mental illness. Research has shown that it affects them. Let's say dad or mom had depression and are going through those periods of depression. It affects the child. Second one was having a family member who is incarcerated. They may not visit the family member in prison or in jail, but just hearing that somebody that they know well is incarcerated. Mom is in prison, dad is in prison. They get a sense of shame that is attached to it. It affects the child. The third one under household dysfunction is mother being treated violently, whether it's in the household setting or they observe mom being treated violently outside on a regular basis. The child is affected by that. These are all what we call adverse childhood experiences. We're going to talk about the effects of that after we've done that, after we've gone through this. The other one is having a parent or a family member who is going through or using substance, abusing substance. In other words, addiction, whatever kind of addiction to substance. when they see mom, they see dad drink and pass out, drink, now come home, drink, yell at everybody, shout at everybody, talk very loud, and do all that, and the child is observing all that. Research has shown that those kind of things affect their growth and development. And ultimately, we will see some of the consequences. The final one under household dysfunction is when a child experiences divorce, when a child sees the parents going through divorce. No matter what we do to say, this is not about you, this is about mom and dad, we are not getting along, it's better with, no matter what we do to downplay the child's home, the child's place of security is rocked. The children experience adverse effects because of that. So what have I counted? Under abuse, we have physical abuse, emotional abuse, and sexual abuse. And then we have neglect, physical neglect and emotional neglect. Under household dysfunction, we have those who are mentally ill in the family, mom or dad are mentally ill, a sibling is mentally ill, and the whole family is adapting to that. And then we have having someone who is incarcerated, meaning they went to prison, they're in jail for a prolonged time, it affects the child. Mother being treated violently, substance abuse, and divorce. And then that leads us to the consequences of it. What are the consequences? Children that go through this, what do they experience? Under behavioral consequences, we see lack of activity, isolation. The child withdraws, doesn't really get into anything. It's not into sports, it's not into habits, it's not into friendship, just a loner, likes to be by themselves. That's one thing you would see. Another thing is early engagement with substance. They start from smoking very early. That's what research has shown. The third thing is they also might start drinking very early. The risk of them starting all these things are high when they have experienced those abuse, neglect, and household dysfunction. And ultimately, when you engage in these things that are going to be health consequences. The other thing is they also get into drugs. So we've seen lack of activities, isolation. We've seen smoking, early engagement with smoking, early engagement with drugs, early engagement with alcohol, early diagnosis of alcoholism. And then lack of engagement with work. They miss schools. They are late going to school. They skip school. And then when the child begins to work, they also miss work as adults. And then we have health issues, physical and mental health, severe obesity, because we're talking about lack of activities and all these other things. It leads to adults developing severe obesity. And then we talk about diabetes. We talk about high risk of depression, high risk of suicide ideation, suicide attempt. That's very high risk of STDs. That's where you see smoking, drinking, drugging, and missing work. You're probably gonna see a lot of high engagement in sexual activities, and those also lead to the diseases that follow it. You're gonna see heart disease, high risk of heart disease, developing heart disease, developing cancer, developing stroke, developing co-occurring COPD, developing broken bones. All these things are tied down to those 10 things that I mentioned: the physical, the neglect, and then the household dysfunction that children experience, and then as adults, they in turn experience all these things that I mentioned. So you want to know, am I at risk? I went through these things. Is that why I'm having depression? Is that why I have diabetes? Is that why I have heart disease? Is that why I've been diagnosed with cancer? Is that why I've had stroke? A lot of us ask this question, or even if you're a practitioner and you're wondering, how do I have my clients go through this to determine whether this is actually their fault or this is where their problem is coming from. Well, there's a free test, and I'm going to give us that link. I'm going to give us that information that you can Google and go do a free test. And that would help you determine whether your risk is very high or not. It's called What is Your Adverse Score? Adverse Childhood Experiences Score. You can go to the website NPR.org. There are a lot of questionnaires or assessments that you can do, but this is the one that is self-administered and you get the result by yourself. So I give these ones out, NPR.org. N for Nancy, P for Peter, R for Robert.org. And then once you log in there, you're going to see the score test that you can take to determine your level of risk. But if you've gone through all these things, or any of these things we talked about, if your number is more than 4, then you need to take this test and determine for yourself whether this is the source of your problem. And then if you have patients that who are also going through this, have them take this test. You can take it in your office if you're a practitioner. Take it with the person, you just ask them questions, they answer, and at the end, you get the score. And from the score, it tells you how to determine the level of risk and exposure. So this is it, advanced childhood experiences and their mental consequences. Why is this important? As a practitioner, it tells you the source of the problem. As a practitioner, it also helps you to have an idea whether if that person has gone through trauma, then we are going to be treating trauma, not just the depression that comes as a result. We're going to have to address the trauma if we want a holistic resolution, or at least a holistic treatment. We're going to treat both, as opposed to just treating depression and you're not addressing the trauma. The depression is the consequences of the cost we need to identify and also address. That's all I have today. If you are watching, we have series of courses that we offer, certification, the TIMFA, which we represent, the Institute for Marriage and Family Affairs. Visit us, TIMFA, TIMFA.org, the T for Tom, I for India, M for Mango, F for Frank, A for Apple.org. You will see series of courses that we offer that would help you to be a good practitioner. And if you're a parent or you're a caregiver or a school proprietress or you're a youth leader, you're a youth minister, these are tools that will help you to be more effective. This month and next month, we are offering what we call the Essential Skills courses, certification. That's going to deal with how to deal with grief and loss, how to deal with single parenting, how to deal with those who are blending families. You've married for the second time, you've married before, you're getting into it new. This course will prepare you so that the mistake that was made before will not repeat itself. And then we have those who are getting into marriage first, the premarital and first 5 years of marriage. Those are the volatile times. So all these courses including domestic violence and care. And then we have the suicide prevention and care. So we have all these courses. Log into our website once again, is TIMFA.org, TIMFA.org. You would see those courses that we are offering. They're really reduced and very affordable. Log in there. And if you're also interested in counseling those who are dealing with mental illness and addiction, we have a 14-week course that is starting in June. Log in there, you would also see it. Or just type in, I'm interested, send us a message, direct message. We'll respond and reach out to you and provide information. Thank you. If you haven't subscribed to this channel, subscribe to it now before you hang up. Subscribe to us share the channel. Adverse childhood experiences and mental illness. That's what we discussed today. Take care. God bless you, and bye-bye.